Hello, I'm Dr. Eric Lee. My main research interest is in high blood pressure or hypertension. Home blood pressure monitoring is actually very important because evidence has shown that it actually predicts death, predicts heart attacks, predicts stroke much better than the blood pressure that we get from the office. Because in the office, many people are very nervous and they have much higher BP than their usual blood pressure, and it's not accurate. So that's why home blood pressure monitoring is important for diagnosis and also for management of high blood pressure. And studies have found that when people regularly measure their blood pressure at home, it actually helps them to have a better control of their blood pressure. Let's take a closer look how to measure blood pressure at home. Prepare a validated machine. Sitting comfortably with your leg uncrossed. Put the cuff around your upper arm. Make sure the bladder of the cuff covers more than 80% of your arm circumference. There should be 1 to 2 finger breadth distance between the elbow and the cuff. Start measurements by pressing the start button. Do not speak when measuring blood pressure. Take at least 2 to 3 readings and then take the average for doctor's management. You can write down your blood pressure readings on a paper or using various mobile apps to record your blood pressure. It will be quite surprising to know that more than 90% of the machines are actually not validated and we cannot confirm their accuracy. So it's important that you buy accurate machines. Then how do you know? Actually, there has been international societies that help patients to decide which machines are validated, and you can visit these websites on which there are hundreds of BP machine models. You just need to choose one of them. Many of them are available for purchase in Hong Kong, electronic stores, hospitals, and clinics. So I think it depends on the purpose of measuring blood pressure. If you're diagnosed to have high blood pressure, it's important that you measure your blood pressure regularly. I would suggest you to buy one because regular monitoring has been shown to decrease blood pressure by itself. However, you are just saying, I want to do screening, I want to measure it once a year. It may not be sensible to buy a machine in that sense. So you can go to, in Hong Kong, community centers, sports centers, doctor's office. All of these places will have a blood pressure machine, and make sure you measure it at least every 1 to 2 years. So on diagnosis, I will suggest patients and doctors to measure blood pressure on both arms. If the blood pressure on both arms are actually quite similar, then it doesn't matter. But if there's one arm that's significantly higher blood pressure than the another arm, by that I mean about 20 mmHg systolic blood pressure higher, then you should use the higher blood pressure arm for future measurements. Because we know that for the lower blood pressure arm, there may be some vessel obstruction and is not suitable for measurement and treatment of hypertension. So for people who do not yet have high blood pressure, it's already okay for them to take a reading every 1 to 2 years. However, if you're going to diagnose blood pressure or you're going to manage high blood pressure, it's important for you to measure consecutive 7 days. 2 readings in the morning, 1 minute apart, and 2 readings in the evening, 1 minute apart. And after the whole week, there will be more than 20 readings for your doctors to manage your blood pressure, and that will be much more accurate than a few readings. In general, we know that wrist devices are less accurate than the upper arm ones, so it's generally not advisable. Unless the patient is very, very obese, it's impossible to obtain an accurate reading at the upper arm. So for most patients, we will advise an upper arm machine rather than a wrist machine. I'm aware that in the commercial market, there has been a lot of devices, coverless devices, mobile apps saying that they can measure BP. but vast majority of them do not have any validation. So we do not know the accuracy, it's better not to use them. However, there has been some mobile apps that helps patients to record down their blood pressure. It may benefit you because you are less likely to forget to bring it to the doctor. So you may use all these mobile apps for recording your blood pressure but not measuring them. So in Hong Kong, we have a dual healthcare system. So you are free to go to find a private doctor to help with your blood pressure. And you may also choose to go to the government-funded outpatient clinics. Although it may be difficult to book, but they also treated hypertension well. In Hong Kong, we also have a website for primary care directory. So you can search for primary care doctors on the website.